All right, let's talk about something that can feel really complex and, honestly, pretty overwhelming: the journey that follows a breast cancer diagnosis. We're going to break it all down, step by step, to demystify the path from that first discovery to treatment and everything that comes after. So, let's dive in. It so often starts with this one simple but huge question. A lump is found, maybe during a self-exam or on a mammogram. So, what happens next? That single question kicks off this whole chain of events, a kind of medical detective story that actually follows a very clear and logical path. Okay, so the very first thing the doctors have to figure out is the nature of that lump. What exactly is it? Is it a benign tumor or is it a malignant one? And this distinction right here is everything. It's the foundation for every single decision that follows.
And when you put them side by side, the difference is, well, it's night and day. A benign tumor, it's usually slow-growing and it's encapsulated. Think of it like it has its own little container, so it stays put. A malignant tumor, on the other hand, is the opposite. It grows fast and it's invasive, meaning it doesn't play by the rules. It starts pushing into the tissues around it. But the biggest difference, the one that really matters, is that it can spread.
And that ability to spread, it has a name: metastasis. And honestly, this is the whole ball game. It's when cancer cells basically break off from the original tumor, hitch a ride in your blood or your lymphatic system, and then set up shop somewhere else in the body. This is what makes a malignant tumor so dangerous, and it's exactly why catching it early is so incredibly important. So once there's a suspicion that a tumor might be malignant, the next phase begins, and it really is like detective work. The doctors need to gather all the evidence to get the full picture of the cancer, looking way beyond just that initial lump. And this investigation follows a really clear path. You start with the big picture. That's the imaging and lab test to get a better look. Then you zoom in for the definitive proof. That's the biopsy. And finally, you take all that information, put it all together, and you stage the cancer, which is really just a way of figuring out its size and how far it might have spread. So what kind of tools are in this detective's toolkit? Well, you've got imaging, like MRIs and PET scans, that let doctors literally see what's going on. Lab tests can look for certain tumor markers in the blood. But the real smoking gun, the most critical clues, come from histology. A biopsy doesn't just tell you, yes, it's cancer, it gives you the full rap sheet on it, especially its hormone receptor status, whether it's ER, PR, or HER2 positive. And knowing that, it's absolutely crucial because it tells doctors exactly what kind of treatment is going to be most effective. All right, let's fast forward a bit. The surgery's done, the tumor is out. So you might think, great, that's the end of it, right? Well, not always. The primary treatment might be over, but the game plan often needs to continue. And this is a really common point of confusion. This is probably the #1 question people ask. Look, the surgeon took the tumor out, it's gone. So why on earth do I need more treatment like chemo or radiation? It can seem counterintuitive, almost like overkill, but there is a very, very important reason for it. Think about it like this. Surgery is like taking out the main enemy headquarters. But what if there are tiny little spies, microscopic cells, that have already scattered and are hiding out somewhere else in the body? You can't see them on a scan. That follow-up treatment, that is the security sweep. It's designed to hunt down and eliminate any of those hidden stragglers. And this whole security sweep idea has a medical name, of course. It's called adjuvant therapy. The key thing to remember is that it happens after the main treatment, like surgery, and its one and only job is to lower the risk of the cancer ever coming back by targeting those invisible microscopic cells that could be floating around. So what's in this arsenal? What does this adjuvant therapy actually look like? Well, doctors have a whole range of treatments available, and it is definitely not a one-size-fits-all approach. It's all about picking the absolute right tools for the specific cancer they're fighting. First up, you've got what are called local treatments. These guys focus on one specific area. We already talked about surgery, that gets the main tumor out. Then there's radiation, which is like a highly focused beam used to zap any cancer cells that might be left behind in that same breast or chest wall area. Of course, every tool has its trade-offs, right? So these can come with side effects like fatigue or skin irritation.
And then you have the systemic treatments. This is that body-wide security sweep we were talking about. Chemotherapy is probably the one you've heard of most. It goes everywhere through the body to kill fast-growing cancer cells no matter where they are. Then, for those hormone receptor-positive cancers, there's hormone therapy, which basically cuts off the estrogen fuel supply that helps those tumors grow. And again, because these are such powerful tools, they come with their own set of potential side effects. Okay, so after the active treatment phase is finished, the journey isn't over. It just shifts. The focus changes from actively fighting the cancer to being vigilant. It's about staying in tune with your body and being aware of any potential signs that something might be wrong.
So what does being vigilant actually mean? You can kind of break it down into 3 categories. First, there are local signs, things happening right there in the breast area, like a new lump or some skin changes. Then there are systemic effects on your whole body, like deep fatigue that doesn't go away, or losing weight when you're not trying to. And finally, there are signs that could point to metastasis, like bone pain or a cough that just won't quit. Now, knowing these things isn't about creating fear. It's the opposite. It's about empowerment.
You know, when you look back at the whole journey, from diagnosis to treatment to long-term vigilance, you see that every single step has a clear purpose, a why behind it. And that leaves us with a final thought to chew on. Knowledge really is power. So how does understanding the why behind each test and every treatment truly change the experience of this journey?